Okay, so I think we can make a start. So yeah, good afternoon everyone and welcome to the webinar. So my name is Kieran Stevens and I'm also joined by my colleague Nicola Pinocci today. On behalf of Williams Medical, we'd just like to take this opportunity to welcome everyone to this webinar on medical adhesive related skin injuries. This webinar is presented in partnership with Essity, and we're delighted to welcome Jane Mays from Essity today. So welcome back, Jane, and thanks for joining us again this afternoon.
Thank you very much for having me. Really, really pleased to be here.
Great. And this webinar, so will be split into two sections. So we're going to spend the first section, looking at medical adhesive related injuries, and there will be an opportunity for questions in the middle. And then Jane is going to take us on a tour of ST's gold standard education platform path. So where we'll be able to find out a little bit more about other clinical sessions that you can complete in your own time. In terms of housekeeping, so we have 1 hour scheduled for this session, and again, this will include plenty of time for questions in the middle and at the end. With regards to questions, we'd like to invite your questions and comments throughout the session. So if you do have a question, please use the chat function, which should be just at the top of your screen. And the final point, so this session will be recorded and will be available following the end of the webinar, as well as some useful resources and materials from the session. So without further ado, I'd like to hand over to Jane to make a start on the session.
Fabulous. Thank you so much for letting me join you this afternoon. So I'm Jane Mays, the Clinical Education Manager here at Essity, but my background is nursing. I've been a nurse for 30 years. Most recently, I've worked in tissue viability. My NHS contract sits within the Christie Hospital in Manchester under tissue viability. So it's an absolute delight to be here today to present to you medical adhesive related skin injury. So I don't know how many of you are familiar with this terminology, but this is something that, really I'm very passionate about, because obviously it's linked to a harm, an avoidable harm, with good assessment that we can get on top of. So let's have a little think around MARSI. Our objective today is to educate you on what MARSI is. We're going to look at sort of like some of the tips and some of the risk assessment elements that you can go through. And it's all aligned to an expert panel meeting that was delivered in 2019, published in 2020. And they provided us with the literature that raises the awareness of and burden to patients and healthcare professionals of MARSI. So just before we dig deep into what the topic's all about, we need to look at the skin and do a brief recap of the skin and how important the skin is. That top fact there is quite interesting. It says, the skin accounts for 15% of our body weight. I always like to say, if you want a crash diet and you want to lose weight, take your skin off. But you'd be in a terrible position if you did, because we know that the skin is responsible for protection of us from chemicals, debris, bacteria. It's made up of 7 layers. And as clinicians and healthcare professionals, our goal is to maintain skin integrity. And funny enough, in one of my organisations, we really took this passion to maximise skin integrity to a real level. And we had badges that said, our responsibility is skin integrity. But the NHS and cheap metal, some of us got a bit of itchy dermatitis on the back of those. So it's always really interesting to think, when we think skin, we need to really protect the skin, and just anything in contact with the skin can be a challenge to us, which is where we're going shortly with the topic of medical adhesive related skin injury. So I like to think of the skin as bricks and mortar in a house. So the house, you can see the bricks, you can see the mortar. Think of that as the skin. And when the skin is impaired and there's no mortar, or the mortar's impacted, then it falls down, the house does, but ultimately the skin can become damaged. And this happens when we put adhesive on the skin and remove adhesive. So we're thinking now about medical adhesive related skin injuries. So what exactly is a medical adhesive related skin injury? Well, it goes back to some work in 2013 where some colleagues, and McNichol is the reference, which you can see on the slide there, they defined it as an alteration in the skin integrity, integrity being the skin as a whole, classified by erythema, redness, and skin damage, including skin tears, and that have happened as we've removed adhesive or medical devices containing adhesive from the skin. We now know that erythema and skin tones can present very differently. There's a lot of talk in wound care about this. So you don't necessarily see redness on all skin tones. So we need to be mindful that this could present as just an altered tone presentation. So after this definition in 2013, further work was done, and it was mainly done by the Skin Tear Advisory Panel. And in 2018, they defined MARSI, medical adhesive related skin injury, as skin tears and trauma associated or caused by medical forces, such as the removal of adhesives, like dressing adhesives. And we've gone one step further now, and we now know the terminology used in the consensus document, consensus panel work in 2020, has brought all that together and says that it's skin damage related to the use of medical adhesive products or devices such as tapes and dressings, stoma products, etc. So now I've given you a nice definition of MARSI, let's look a bit deeper at elements of this avoidable harm. As well as compromising the skin barrier and delaying wound healing, medical adhesive-related skin injuries can cause pain to the patient, pain, distress, and can cause further morbidity or, for example, wound infection or infections of the skin. It's an anxiety-provoking element, and it really does impact on quality of life. And I relate very closely, professionally, to scenarios that I can reflect on, but very personally, my son had a terrible appendix that all went wrong, to cut to the chase, and his biggest distress was the removal of the dressings and that compromising the skin, and he was getting a lot of irritation and trauma on dressing removal, and so it's very common but underreported. So let's think about what causes these medical adhesive related skin injuries. There's patient factors and there's environmental factors that are related to this topic. Some patients are at high risk, but however, we must remember that anyone that's requiring the application of a dressing or a medical device with adhesive in it is at risk of a MARSI, a medical adhesive related skin injury on removal. It's simple when we think back to ourselves, the plasters that have got really strong adhesive in, we know how painful that is on you and I when we remove those. And if you've ever done that, which I'm sure you're familiar with yourself, if you've removed a dressing and you've got that trauma there, actually what you've got is a MARSI, a medical adhesive related skin injury. There can be different levels of severity of these, but ultimately they all come under that umbrella term. So let's have a look now at the risk groups. And like we say, anybody is at risk of a medical adhesive related skin injury, but people with fragile skin are more at risk. For example, the elderly. And this is mainly due to the loss of the structure of the dermal structure and matrix of the skin. The aging process is not kind to us all. My skin is definitely compromised as I'm getting older. It becomes thinner. Patients become dehydrated. I can tell the difference when I've not drunk fluids through the day in my skin, turgor, tension, elasticity within the skin. So the elderly also have less connection between the top layer of the skin and the dermis. So the epidermal junction becomes flattened. In you and I, that's connected quite well, the top layer of the skin and the dermis, the next layer down, almost wavy and interlocks together. That flattens in the elderly, so the two layers of the skin can move between, and so that can cause trauma in itself, and when you're removing adhesive can cause a medical adhesive related skin injury. There's less blood supply in the elderly skin, so that can prevent the wound from healing if there's been a MARSI developed. So the elderly are a risk group. Another risk group are infants and young children. And yeah, that's definitely where my son, he fitted into this group. You know, from birth, we find that these neonates and children are more at risk. They have immature skin that's underdeveloped. The skin itself after birth is 40 to 60% thinner than an adult's skin. So it's very thin and very fragile. So MARSI is a real risk in neonatal care when they're trying to secure devices such as feeding tubes, or they've got tapes to hold other elements in place. Another risk factor will be medications that patients take thin the skin, and could be an element of comorbidities. So we all know those that impact on our skin make our skin thinner. Those comorbidities need these medications to manage them. Probably one of the ones that we don't really think a lot about is the constant removal and frequency of dressing changes can be a challenge to us. So those patients that are having to have the dressings on and off due to high levels of exudate management, they're more at risk. Their skin is more fragile. And one that I see a lot of, another risk group, are those patients that are receiving treatment for oncology. So those oncology patients, I see this a lot in my work at the Christie, the skin is a lot more vulnerable. So we can see now how we've come to the conclusion that many patients are at risk of trauma from the removal of dressings and products with sticky adhesives in them. So let's now think a little bit more around sort of like the risk factors and the percentage of elements that those patients experience. From this slide, we can see that skin damage occurs in 50% of the elderly, like we said. So that's a big population that we see. And we know from what I've just been saying, it's underreported because that small amount of erythema, excoriation on the removal of a dressing is a MARSI, but we don't go and report that. And there's no formal reporting process. So we don't know the true number, but we definitely know the impact to the patient. We know ourselves how that feels. And because the true extent of the problem isn't fully known, this makes it difficult for us to push it into strategies and planning to make changes in practice. So we need to really acknowledge and report these elements, these MARSIs, in the correct processes and document them. So what can we do? What role do we have? We need to really implement a full skin assessment of our patients. What I really would love to see you do today is, before you put any product or any device on a patient, stop and think. Assess the skin. How at risk is that patient of a medical adhesive-related skin injury? What is the current state of the skin? What is the turgor like, the elasticity in that skin? What's the moisture level like? Are they dehydrated? Is the skin thin and compromised? I mean, this picture is just, I know it's a very full-on, anybody who's squeamish or about to have lunch or eating lunch, it's a really impactful image, but you can see the skin around it is crying, is shouting to us, I'm vulnerable, and how vulnerable it is. Like we said, we need to document for the prevalence and incidence data of MARSI. We need to document these and report them as needed. We also need to educate the family, the patient themselves. We need to ensure that they are, taking on board their skin, looking after their skin. Good skincare should be incorporated into all our elements. And I'm sat here with very dry skin. I don't like the feel of emollients, and I should know best. Keeping your skin to the best quality it can be stops it from damage and maintains its integrity. So skin integrity is all our priorities, and it needs to sit within us as individuals, but also in our minds as healthcare professionals. So when we go now and think how we can prevent the MARSIs, it's vital that we, yes, promote good skin health, as we said, but do simple things, such as, thinking around how the patient is using, if they're using a lot of soap that can change the pH of the skin and affect the skin's integrity, just simple conversations that we can have with our patients to minimize the risk their skin would have when we're applying products with adhesive in them. We also need to make sure that patients think around the dressings that they are personally using, but also the dressing selections that we are putting in place for our patients. So if you think about dressings generally, there's two really different types of stickiness or adhesive. There's acrylic types and there's silicone types. So I remember, because I've been a nurse too long, when there was just elements of acrylic adhesive, and I'm sure there's other people there thinking, I remember those days I'd put a dressing on and I'd be like cringing and really trying to remove it on the patient, and there'd be trauma a MARSI caused. Our advances in dressing technology have come a long way, so there's different types. But what actually happens in a MARSI is that the adhesive is stronger than the skin's ability to hold it. So when you remove it, the bond is strong and you remove the skin with it. So we need to think about what dressings that we use, and any dressing that you apply with pressure and the skin is warm, those acrylic adhesives grab between the skin folds, and there's a strong bond over time with those acrylics. So it is pretty much like the glue focus on the skin, and some skins can take that and some patient skin can take that, but in contrast the silicone based adhesive dressings that we see are softer and gentler and maintain a constant level of adherence over time, but are not harsh in how they bond to the skin. So ultimately removal is less traumatic and medical adhesive skin injury reduction occurs. So you'll also see other elements of interventions that we can put in place, like medical adhesive removers are routinely used in some elements of care so that you can dissolve and remove the adhesive before removing the product or the dressing. So we're coming towards the end of our first session that I wanted to join you for today, the educational session around MARSI. But I do want us to just recap on what we've explored today, and I just want us to think about our roles and what we can do, and some takeaway messages. So my big message is stop and think. Before we apply anything to anybody's skin, have MARSI at the back of your mind, and think about that patient and what type of dressing or adhesive is best for that particular individual. We know this, never try and remove an adhesive dressing or a medical device with one swift action. How many times have we done that, even with our children? That quick removal of plaster is the best. Fast removal, it's not what we want to advocate. You want to be, it'll just cause pain, it'll just cause trauma. There's higher forces as you're removing it. So slow removal, that's the way forward. It's very much, allowing that unfolding of that adhesive, but not causing that trauma that we're so familiar with. It's a lot gentler, slower, and it'll allow for that easier removal of those products. And I think my big closing point is maintaining skin integrity is everybody's responsibility. We all have our role to play in educating our patients, educating carers and families, and thinking ourselves, because these are, on a whole, an avoidable harm that we can avoid happening when patients are in our care. So hopefully I've taken you on a journey there of what MARSIs are, the fact that we don't know the true incidence and prevalence because we're not reporting them, what we can do with regards to assessment and assessing our patients' risk. We looked at who is at risk of MARSIs, and some selection elements that need to be at the forefront of our mind when we're considering applying adhesives or products, medical devices with adhesives in them to our patients' skin to prevent these harms from happening in the first place. So I know Kieran's there, and we're going to just look now at any questions that have come in on this topic, and then I'm going to take you on a little whistle-stop tour of the platform, show you where you can find this module recording to watch it again or share with colleagues, and we'll come back to... Oh, I can see you now. I was just wondering where you were there, Kieran, but I can see you now.
Yes, thank you, Jane. A really great start to the session. Thank you. So I guess, yeah, before we load on and have a tour of the path, we've got a small window opportunity for some questions. So there isn't anything in the chat at the moment.
Okay,
but
that's always a good sign, Kieran. It means that we've touched everybody's needs.
Yeah, but if anyone does have any questions, please use the next couple of minutes to drop them into the chat, and then we can cover them for you.
Excellent. So while we're thinking if there's any questions or anything in clinical practice, I think it's good to do just a piece of reflection as well, Kieran, isn't it? I know modules like this make me stop and think and make me think about my previous practice, but also what I can put in place personally to move forward to make my care better for the patients that I'm, delivering care to. So yeah, hopefully we've given you that knowledge. So what I'm going to do now is show you our educational platform here at SRT. And yes, there's a whole wealth of education on this platform to really meet the needs that I'm sure you have around different topics. So I'll take you there now. I'll share my screen. Let's have a little look.
Tell me, Kieran. Jane is doing that. If anyone does have any questions, please pop them in as we go along. And yeah, we can cover them towards the end of the session as well.
Fabulous. Can you see that all right, Kieran?
I can. Thank you.
Brilliant. So here at ST, we really do put ourselves in a really good place to provide you with really high quality clinical education. As you can see, we have elements within our educational offering endorsed at university level. That means that they have approved the modules and the content that's on the platform. We're working hard to get more modules all the time endorsed by the universities that we work with. So today I just wanted to take you on a little tour of the platform. After today's session, we'll give you a registration flyer, which will allow you to register and have a look at the content on there. It's a very simple platform. As you can see, at SRT, we cover lots of different therapy areas. We cover wound management, and we've looked at that topic today, and I'll take us into that content on the platform in a moment. We also cover lower limbs, so anybody who's challenged by patients with underlying limb conditions, so for example a swelling or venous leg ulcers, we've lots of content on the platform around that. We've also got orthopedics on there, we've got lymphedema on there, we've got continence on there, and I can't forget our animal healthcare little signpost path there. So we do a lot of education for animal healthcare, and yeah, I've learned so much in the role that I do, but we have had some nursing homes want to learn about pets that they've got in their care at nursing homes. You never know, or you just might have an animal that you want to explore knowledge on for yourself. So we do have that path there. Excuse me. This video at the top here, when you register, you land on this page. This allows you just to watch this video, and it's a little video saying scroll down here, click on the area of interest, and then you'll be able to access the content. So it's a nice way of obviously recapping on what I'm going to show you now. So let's take a look in our wounds management path. So I'll click on here. There we go. Might just be a little bit slow, but no, we're fine. So these are all our topics of learning, and what I wanted to do today is to just highlight a few that you may find interesting. We've got a really good sort of like small module on addressing skin tone bias in wound care. So this is a 15-minute module, and it's a topic that we're quite passionate about at SRT, and it sort of talks around a little bit I touched on in the module, which is how different conditions present in varied skin tones. We have different styles of learning on the platform, so we have bite size that's just a few minutes, but we have webcast content as well that's a lot longer on the topic. So this is a conversation panel discussion about that hot topic of pressure ulcer prevention features in here. But, you know, this, how can we assess when we have always reacted to red in pressure ulcer prevention? But what does that mean? Because if different skin tones, redness doesn't appear in the way it does on other skin tones. It may just be a different pigment, a deeper pigment, or it may just be more of a purpley pigment. So it's all about us being able to think around that in practice. So that this is our addressing skin tone topic that sits within the platform. So to access any of that, you'll just click on the topic and then play the content. You'll watch the content and then you'll be able to download a certificate after completion. So I just wanted to touch on a few more. So the ones that are really interesting, I think, are anatomy and physiology of wound healing. So you'll be like me as a clinician out there. We don't really get this knowledge. I didn't get it in my nurse training. I picked bits of it up along the way. When I became passionate, went into tissue viability, I obviously learnt a lot more. But the patient's body heals the wound. So this module talks you through that content. I'll just bob in and show you. It talks about the phases that up there, because you can see I've been active on the platform doing these courses. And yes, it's very much going to show you the phases that wounds go through to meet healing. So that being the inflammation phase, the proliferation phase, and the maturation phase. So it talks through those in a nice graphical way. So it tells you that you're going to do a little test at the end. That's what that pop-up tells you. And then obviously we can then move into the content. So it'll just give you a little introduction. And the great thing about e-learning is you can just do it at your own pace. And yeah, you then get a certificate at the end of that. So that's a nice module for me to signpost you to, anatomy and physiology of wound healing. We've also got a nice one on the anatomy and physiology of the skin. And we've got things there that you can see on infection management and prevention, wound bed preparation, exudate management, surgical site infection. I know we touched on this, Kieran, last time on one of our sessions, but on the platform, you've got a nice e-learning, and you've got, which again is slides to work through at your own pace. But we've also got here, we've got some nice webcasts to watch and learn about surgical sites, infection prevention and management strategies in there. So there's so much content to go at. There's something for everybody or for what your individual needs are. This module that I presented today sits in our Path Education content under wounds management. So it's medical adhesive related skin injuries. The content's very similar to what I presented today, but if you wanted to revisit that content, share with colleagues, etc., then there's a 10-minute recording version on there. I'll just jump into that session. As you can see, the only difference is the hair colour has changed, but other than that, the content is the same. And I've managed to pause myself on a terrible screen there. But yeah, you can see how this platform is coming together to work for you. So we had a little conversation before the call about continued professional development. So yes, as nurses, we know we are regulated by the Nursing and Midwifery Council, and every 3 years we have to re-register. So this content will allow you to build up those hours of learning. All the courses have those hours that it takes you to complete, and that appears on the certificate when you download a certificate at the end. So Stephen and I were Kieran and I were very conscious that we wanted to make this session very simple and practical. So this is about registration through a flyer. Click on the link to register, takes you to the landing page, scroll down and find the content that's under your needs. So everything's laid out the same. I'll just very quickly, before we finish, click on the continence care. Lots of things in there about continence assessment, dementia and continence. That's a really good path. That's got lots of content in there around the toileting pathway and how that impacts in dementia. We've got breaking barrier topics, transgender urology, we've got UTIs, we've got plenty of content there to go. I think there's about 143 courses on here, so there's something to meet all our needs. So that's the platform. Kieran, I'm conscious that yes, we've whistled through that. We've gone extremely fast, but I thought I'd check to see if there was any questions, and then I'll show the visual of the flyer for the platform.
We don't have any questions at the moment,
Still
so I
no
encourage
questions.
people to add them.
Yeah.
I have a couple of questions in the meantime, Jane, if that's okay.
Fabulous. Yeah.
Obviously, a very comprehensive library of education. Providing someone wanted to complete all the modules in one of the sections, such as wound care, is there a certain order you would advise people to work through in, or is it quite intuitive and dip in and out?
Yeah, that's a really good question, and we're actually looking at some of that. Back to basics. What would be your back to basics? Really, is your question, Kieran? I'd say for wound care, we've put it all in as pick and mix, choose what you like. You know your own needs, but I think yes, it's good advice to start with. For wound care, I would definitely recommend A&P of the skin, and A&P of wound healing, how wounds heal. And after today's call, I can give you direct links to that. So literally, you'll be able to press on a link, and it will take you straight through to that content on the platform. It's not hard to find, but I know I'm a nurse. Like, if it's not one click away, I give up. So I'll share those documents, Kieran, with you so you can circulate those. And I think we might have a question, Kieran, which is good.
Yes, so we've got, thank you, Carla, for the question in the chat. So are the e-learning sessions on Path free, or do we have to pay for them?
Absolutely, yeah, totally free. So as a medical device company, we're obliged to give clinical education as part of an added value. So obviously these are clinical medical education that we need to deliver to support, obviously, clinicians in decision making, and then we keep our product education very separate. So yeah, absolutely, open access.
Brilliant. And as Jay mentioned, she'll come on to the registration process in a sec, but we'll also, as part of our sort of post-event communications, share the links with you as well. So you've got a couple of ways to find it. And then, the process is quite straightforward.
Yeah, really straightforward. Yeah, it's nice to be able to bring this to you, Kieran, to be able to support people with the education and learning. It's definitely what we're passionate about. So, yeah.
And one more from me, Jane. Do you have a favourite module?
They're all my favourite, but thank you for that, Kieran. I absolutely love the holistic assessment of the lower limb. I'm a community clinician through and through, and I have definitely built that module with Huddersfield University's endorsement from a real personal place of the challenges that we face in the community, practice nursing included, when patients present with us with lower limb swelling or with venous leg ulcers. That module takes you through everything, and I will include the direct link to you. Everything you need to know to carry out a full holistic vascular assessment of the lower limb. So you asked me the right question, because I absolutely love that module. It's so invaluable to us all in community and primary care.
Brilliant.
So that's my favourite.
Great. Okay, so we don't have any other questions from Carla. Do you want to explain the process of registering, Jane?
Absolutely, yeah. So thank you, Kieran, for that. So I'll just share my screen again. Hopefully you can see this clearly now. Does that come through there, Kieran?
It is, yeah. It's on screen.
Brilliant. So PATH is our concept for education at SAT. So professional accredited training for healthcare professionals, an acronym built around a journey. We know everybody's on an educational journey as healthcare professionals. So that's where our concept was born. We wanted to make it simple. We want to make it engaging, but we want it to be easy accessible. So the platform content is just one part of our PATH offering. Today, where we're interacting together, is another part of our offering here at SAT. So we're focusing on our self-directed elements, which are the e-learning and the webcast learning. And we have them, as I've showcased, in lots of different therapy areas: continence care, lower limb management, lymphedema care, wound management, orthopedics. Don't forget those animals. So we have lots of different therapy areas, lots of different sessions built within it. So this is the flyer that we will share. And the second page of it, you can see we have a little URL there. The digital version will allow you to click through to that URL and it takes you straight to the registration page. Just a few elements to fill in, and then it'll send you an automated email back. You click on that and you end up on the landing page that I showed you. With regards to the links that I'm referring to for the A&P of Lego, A&P of leg ulcers and also vascular assessment, and A&P of the skin and A&P of wound healing, those direct link PDF documents that will attach, click on the link and it'll just take you to the registration page and then straight to that content. So you can't really go wrong, Kieran.
Brilliant. Yeah, it doesn't look like the process could be any easier,
No.
to be honest with you, Jen. So
I'm simple, Kieran. I like things to be simple. So when we started to develop and build it, that was my overall objective. We're so busy as healthcare professionals. Accessing learning has to be easy. So yeah. But yeah,
brilliant.
I think that's...
And I guess the big benefit of the platform for everyone is the shorter sessions, bite size. You can do as many as you want in one go. And yeah, it fits around the working day. So
it so does, because the working day is busy, isn't it? It really, really is busy. So yeah.
Brilliant. Okay, so if anyone does have any other questions or comments, please drop them in the chat over the next couple of minutes. But on behalf of Williams Medical, as one of the leading partners for healthcare professionals in primary care, we are dedicated to supporting your everyday. So that's both from a service perspective and also through added value and education, as we've been able to deliver in partnership with Essity and Jane today. So our offering spans across numerous medical services, along with thousands of products in our disposables, pharmaceutical and equipment categories. You'll note we're very proud of our excellent rating on Trustpilot, and just want to reiterate that we're here to support you and help you save time and effort with our omni-channel shopping experience. So we could pop the next slide on, please, Jen.
Yeah.
And finally, really excited to introduce Williams Plus. This is our new reward scheme at Williams Medical. We recently launched this on the 1st of November. And yeah, Williams Plus allows you to earn rewards every time you shop. And you can find out more about this and your eligibility for the scheme by enrolling and visiting wms.co.uk/Williams Plus. And then one other slide, I think, Jen. So yeah, just to bring the session to a close. Once again, thank you, Jen. Thank you, Essity. And thank you all for joining us today. We'll be following up with the resources that Jane sort of talked about over the coming days. And yeah, please don't hesitate to contact us or Jane or Essity if you need any support.
Thank you for joining us. Thank you very much. See you soon.
Brilliant. Thank you all. Enjoy the rest of your days.